clinical trial that I'm now a candidate or taking part of, it is a daily pill, and it's a pill that cuts off the protein pathways for the mesothelioma. So in other words, it'll starve off the blood vessels. It'll starve the blood vessels to the mesothelioma growth. So it'll inhibit and kill future growth and present growth. So in combination with the IV chemotherapy I'll be receiving, which is every 3 weeks, I'll take a daily pill. I had 16 rounds of radiation, and that was pretty much the whole month of April. And right now I'm on a hiatus, but I begin with chemotherapy next week. The radiation is very easy. You just basically lie on a table. For me, some people have, like a mesh apparatus that they form, but for me they did what's called a bolus, which is almost like a gelatin Dr. Scholl's insert for your shoe, but they put it on your side. So Dr. Jeter traced an area based on the CT scan on my left side. They taped that onto me every time I went in for radiation. The radiation process, I guess it's called a cyber radiation. So it's a very direct hit of the tumor area. And I think the treatment was a total of 4 or 5 minutes with the radiation, and the process from start to finish was maybe 15 minutes. From getting there, checking in, to leaving the table. Unfortunately, my abdomen was in the field of radiation, so my side effects involved nausea, and there was constant nausea, and it just reminded me of, at the beginning of my pregnancies, how queasy I was. So I was queasy for about 6 weeks. So I just had to eat what I could, and smoothies were my lifeline. I drank a lot of smoothies with lots of protein. At times, I get very overwhelmed with the thought of having cancer and being a cancer patient, particularly since I've lived a pretty clean life. I haven't done anything crazy and not been a big smoker or drug addict or, and a lot of times you think, oh, well, people bring stuff on themselves, and that's totally not true. I had this idea that a lot of times people who have lung cancer, and mesothelioma is a form of lung cancer, oh, it's because they smoked. Well, I didn't do any of that, and I've always been athletic, and I've always eaten very healthily, and always taken care of my body, and it puts a different perspective on things, and you really have to stay focused on staying in the present and enjoying every second of your life and being grateful for whatever comes your way. And so for me, this has been a very graceful, grateful experience, because I have learned certainly a lot about myself, but I've learned about the caring, amazing people at MD Anderson. The people that are involved in my life are so incredible, and I'm so blessed and so grateful.
I think you're ready.
I'm ready. I've been here for 6 hours.
And so you come back for this again, what, 3 weeks from
In
now?
21 days.
And what do you do in between?
Right then, since I'm in the clinical trial, I'll be taking a daily chemotherapy pill. I really feel like everything's gonna be okay. I think the worst is behind me. I think getting diagnosed with this type of disease is the worst part of it. And then the rest is all about getting better.